And welcome back. Right now we're talking about female hair loss. It is more common than you might think. In fact, women make up 40% of those struggling with the problem, according to the American Hair Loss Association. So what are some of the more common causes and treatments we want to talk about? Dr. Samadi, I have heard that women who are taking, I've heard them say they're on cholesterol medication and their hair starts to fall out. Is there something to that?
Yes, it's true, and this is a great topic. Did you know that 35 million American women suffer from hair loss? This is something that's devastating. It takes your self-confidence away. For men, it's kind of a macho thing. Oh, he lost his hair. He must have a lot of...
I don't know about that.
Even though I know you were going to run with this. But the truth is, when it comes to women, it's very emotional. It takes their self-confidence away, and they need to know what's the reason. A lot of times, these are genetic, what we call androgenetic alopecia, meaning that the same hormonal changes that happens in men, it can happen in women also. The dihydrotestosterone that we talk about makes the follicle of the hair kind of weak, and you can lose your hair.
Wait. If you're a woman, if your father was bald and you're a woman, would you lose your hair? Because you think if your son and your father's bald, that could happen.
Yes, you may have the genetic risks, and they are more susceptible to this. But also the one that's also very often is seen is basically as a result of natural and environmental things. For example, stress is a huge factor with this. You know, people that go through illnesses, people that go through surgery or chemotherapy, etc. And there's a 3-month lag between the time that your hair is kind of growing to the resting phase. We don't have time to get into it, but when somebody comes in and says, hey doc, I lost all of my hair, you want to know what happened 3 months ago, what kind of work issues they had, marriage issues, stress level that they had. And the good thing about this is that it will come back after the stress level is done. One of the things that you need to know is to find out about your thyroid, hypothyroid or low thyroid, or women that go through a lot of heavy menstruations and they lose tons of iron and ferritin, which is a storage form. We can check and find out exactly what's going on chemically with you and replace your thyroid, replace your iron if you're anemic, and fix this. So you don't ignore it. This is not normal.
So Mark, you can also get like what, hair transplants?
Well, I want to ask him something specific, because I brought this segment to the table because I was at the hair salon, and you know I'm always listening to other people's conversation. If you're around me, don't say anything you don't want me to know.
Oh boy.
So anyway, I overheard the lady next to me talking about, and I got the spelling of it, spironolactone, right? And I found out that she was taking it. It's really a water pill, but it was helping her hair grow back. Now, of course, I'm not endorsing that. I'm asking you about that, though.
Well, okay, so and I'm really glad you brought this up, Arthel. First of all, you have to figure out why you have it, as David was getting into. Other things like autoimmune diseases could be a result. You could be on medication that's causing it, like birth control pills. It could be stress. Once you figure out why you have it, then we can help treat it. First thing we could do to treat it is use Rogaine or minoxidil. That's actually approved in women. We don't know how that works. They're still studying that on the level of the follicle, but that stimulates hair growth. The second thing that works is Propecia, actually, which works in men for the reasons David already mentioned, which is it blocks the dihydrotestosterone. The third thing is what you just said, and I got around to it the long way. Spironolactone is something we use to lower blood pressure. We use it in heart failure. It's a diuretic, so you got to watch out for it. It's used in polycystic ovary syndrome for women that aren't ovulating the right way, and the reason is because it blocks the male hormones in there. It blocks androgen. So you see, it might work to build your hair back up, but guess what? All the other things I mentioned worry me. It's a diuretic, so it dries you out. It lowers your blood pressure. Too many side effects. So it's off-label. You have to make sure that
you got to check with your doctor.
Go to a dermatologist who's a specialist in this before you start taking it.
It's very interesting because
it works. But I think it works.
What dermatologists do, actually, they can get a biopsy of the scalp and actually find out exactly what's going on with you. And besides minoxidil, which is really important, that's only 2%. I don't think 5% is approved for women yet. They can also get a lot of other medications. Now, vitamins for hair may or may not work. Most clinical trials with biotin and others really have not helped with this. But we get your blood test, you check your thyroid, you check your iron and everything else, and then we can tell you exactly what's
going on.
And
then, Eric, women can get hair transplants.
That's what I was going to say. That's a big thing now with women.
Yes,
you can
absolutely.
That follicle transplant system. We've got to go.
One more tiny point is that it may be normal. I also want women out there to know menopause causes this. It may be normal. It may not be anything wrong with you.
Good point.
Good point.